for me, probably the two sessions that were the best were actually one of the concurrent plenary sessions focusing on the microbiome and some of the data that came out that was presented both by Omnibot as well as others in that session. And then the other session that was actually probably the highlight for me was a session that was done with the WMDA and the National Merit Donor Program. That was actually a session in Zoom that talked about all of the implications that the pandemic has had on us acquiring cells from donors and the changes that were required and that were implemented due to border closures, concerns about transportation of cells, and hearing how those donors, the donor registries were able to respond and the plans that they have going forward, because the changes that were made included things like cryopreservation of cells from unrelated donors. This is not something that has typically been done. In general, what the practice has been to infuse fresh cells, which means that a volunteer donor knows that those cells are getting infused. We now have a situation where cells are being cryopreserved, and for some of these donors, those cells aren't getting used for patients because something has changed. And how do we ultimately end up making sure that that volunteer donation is still valuable? And so there were some discussions related to that, both from the National Merit Donor Program, Be the Match, and DKMS. And that probably for me, while it wasn't, a data-driven, novel, abstract type session, was actually a very good practical session for us at transplant centers.